Most people don't know what home health care is until they really need it, until it's urgent, until it's last minute. So let's help you. Let's walk through how to help you make the right decision for your family or for your loved one. So what is home health? Home health can be confused with a few different things. It can be confused with home care. It can be confused with hospice. But let's talk about what home health is and the difference between home health and clear it up for you, because home health is actually super essential. Home health care is skilled care right at home, and it's through insurance. So when you're thinking about a post-hospital stay, or you're thinking about your loved one just recently fell and is needing physical therapy, insurance covers that care at home, and it's not for a long time. It's what they call intermittent. So for 60 days, 120 days, and so on. And usually it's a skilled and medical need for your loved one to be safe at home. So nurses come into the home, physical therapists come into the home, and they usually come 1 to 2 or 3 times a week based on the need and based on the necessity. Now, in order to get those things started, you have to have a doctor overseeing the care of your loved one to write that order for home health to go out. And honestly, it's great. It's a great service and it's a great help, but it's not forever. It's for specific, what they call exacerbations, or specific needs that are acute. So usually a post-hospital stay, or there's something that happens at home, you get a new diagnosis. But within that criteria is usually for those who are Medicare aged. They have to be homebound, which is hard for them to leave the house. They need an assisted device or something to help them go back and forth, maybe a walker or a wheelchair, those things that help them get to and fro. And so that's home health in a nutshell, the skill side of home health. Okay, so now hospice. What's hospice? Isn't it the same as home health? Isn't it the same as home care? Well, it's not. Hospice is usually recommended for families by a doctor if they may have 6 months or less to live. If your loved one is not doing too well, and there's specific categories of diagnosis which can be seen in several other videos on our channel, but it's really for care and comfort, for quality of life in a loved one of yours who has 6 months or less to live. So you're looking at assistance at home. Now you're still looking at someone coming in, but it's not that 60-day stint. It's usually now a benefit of care. And so there's recertifications, there's renewals to see if your loved one still qualifies as they're continuing to decline. But within that, there has to be those diagnoses that meet and qualify your loved one to get care. There's a lot more benefits when it comes to hospice care underneath Medicare. You get more nursing assistance at home. It's not round the clock, but it is more care because of the disease process. You get more aid services, or you can get 2 to 3 to 5 times a week of aid services. You get DME equipment, you get supplies. Now think of all these things that are happening to keep loved ones and families safe at home, to keep them from going back and forth to the hospital if they qualify based on that diagnosis. So that's hospice. It is there to help comfort you, to comfort the patient, to help them maintain their quality of life even while they have limited days here left on earth. Okay, so what's the key difference between home health and hospice? Let's talk about something that you can remember. When you think about home health, you're going to specifically think about recovery and improvement. Say it with me. Recovery or improvement. That's kind of corny. Okay, you get that. Hospice, you're thinking about comfort and quality. Right? So the goals are different in those situations. So within those two, there still has to be qualifications that are met in order for you to get those services for home health and for hospice. Okay, let's talk about 2 quick examples. Let's talk about Mrs. Johnson. She had a knee replacement, and the doctor ordered home health. And for that home health, a nurse came out a couple times, and the therapist came out a couple times. The nurse came out to review the wound, and the therapist came out to look at that knee to help with the range of motion, degrees. And so you're looking at, within a week span, 2 visits from the nurse, 3 to 4 visits from a PT. And for that specific type of home health, you're really looking at someone coming into your home, taking care of you for about 2 to 3 weeks max, and then you get discharged to outpatient and you go about your life. You enjoy the things that you love to do. And so in this situation, now you're looking at the two phrases, the 2 words that we said, which is recovery and improvement. So the second situation is Mr. Lopez. He has advanced heart failure, which is CHF, congestive heart failure, and his symptoms are getting harder for him to manage, and he's no longer improving in his conditions. So hospice now can come in based on his diagnosis to help him stay comfortable, to help him and support the family, to keep him safe and comfortable at home, with the goals of not having him go back and forth to the hospital doing aggressive treatment. It's really now enjoying the time that he does have at home, to enjoy the days that he does have left. Those are the two examples that you're looking at, Mrs. Johnson and Mr. Lopez. So we see these types of situations every week, all the time. And a lot of times when you're looking at home health and you're looking at hospice, you're looking at home care, it can get super confusing. And so I hope that this helped kind of clear the mud when it comes to knowing exactly what each sector of care at home is and how you can be helped, and how you can support your loved one, or you yourself can get the help that you need. So hey, if you like this video, please make sure you like and subscribe. Join us every Tuesday, where we do a live webinar. We're in Dallas, but this live is going to be on LinkedIn, YouTube, all of our platforms, where you can watch and hop in and ask some questions and have a live Q&A chat with myself or one of our care providers. Hope you guys enjoyed this. Continue to like and subscribe, and we'll see you on the next video. Peace.